Welcome to FirstLight Home Care Support Worker Professional Development. By the end of this presentation, you will have understanding of the standards of practices and understanding of the Code of Ethics and Code of Conduct, among other things. Let's review the standard of practices. It is a mandatory expectation for all support workers as follows: to promote and maintain a safe and comfortable environment for clients, their families, self, and others. To communicate and demonstrate basic information in accordance with a pre-established plan of care. To complete and maintain related documentation and records. And to act responsibly and be accountable for your own actions while recognizing the boundaries of knowledge and skills within the support worker role that require collaboration with the clients, families, supervisors, and/or other members of the interprofessional care team. To assist with all activities of daily living by applying basic knowledge of growth and development, common alterations in functioning, disease prevention, and health promotion and maintenance, rehabilitation, and restorative care. To perform delegated tasks by a registered healthcare professional in compliance with the Regulated Health Professions Act for which transfer of functional training has been met. To assist clients with medication in keeping with the direction of the plan of care under the direction and monitoring of a registered health professional and in accordance with all applicable legislation and employers' policies. And lastly, to perform light housekeeping duties. Now let's review the 5 rights of delegation. The right task. Think to yourself, can the task be delegated? Does the Provincial Nursing Act or Health Professions Act allow the nurse to delegate the task? Is the task in your job description? Have you been trained to do the task? A job description should be available. The right circumstances. What are the client's physical, emotional, social, spiritual, and cognitive needs currently? Do you understand the purpose of the task for the client? Do you have the equipment and supplies needed to perform the task? Do you know how to use the equipment and supplies? The right person. Do you have the training and experience to safely perform the task for this client? Do you have concerns about performing this task? The right directions and communications. Has the nurse provided clear directions and instruction? Has the nurse told you what to do, when to do it, what observations to make, and when to report back? Are the directions legal, ethical, and consistent with the employer's policies? Can you review the task with the nurse? Do you understand what the nurse expects? And lastly, the right supervisions and evaluation. Is a nurse available to answer questions? Is a nurse available if a client's condition changes or if problems occur? After the task is completed, does the nurse assess how the task affected the client? And does the nurse discuss your performance with you, telling you what you did well and how to improve your work? So keep in mind these 5 rights of delegation when it comes to a certain task that you have not ever been trained for or that you're not quite sure of. So please make sure to connect with your nursing supervisor. Now let's review the personal care. Personal care involves bathing, bladder care, bowel care, as well as dressing. And these are the most important activities of daily living, and these tasks can be very difficult and can even be unsafe for people with limited mobility. When it comes to supplies, it is important to be prepared with the proper supplies before you bathe, toilet, or dress a patient. This will not only help the process go more smoothly, but it will prevent you from leaving the patient unattended to retrieve certain items. Now let's go over different types of baths. Complete bed baths involve washing the entire body while the client is still in bed. It is given to clients who cannot bathe themselves, clients who are unconscious, paralyzed, in casts or traction, or weak from illness or surgery. Explain to the client how a bed bath works and that the person's body will be covered for privacy. Towel baths. This usually involves an oversized towel and is used so as to cover the client's body. The towel is saturated with a cleaning solution which contains water, a cleaning solution, and skin softening agent. Clients with dementia often accepts this type of bad bath as well. Tub baths and showers. Some clients prefer tub baths and some prefer showers. Regardless, falls and burns from hot water can occur, so ensuring safety is key. Tub baths. Many clients find tub baths relaxing, but they can cause a client to feel faint, weak, or tired. These risks are greater for those on bed rest. As such, a bath should last no longer than 20 minutes. The partial bath. This involves bathing the face, hands, axillae, which is the underarms, back, buttocks, and perineal area. These areas develop odors or cause discomfort if they are not clean. Partial baths are given to clients who cannot bathe themselves, and some clients may be able to bathe themselves in bed or standing at a sink. Some problems that may arise are that some clients cannot tolerate the typical bathing positions, so you must accommodate the procedure to the client. Clients with dementia are often frightened, so keep these things in mind. Let's review perineal care. Perineal care involves cleaning the genital area and anal areas, which provide a warm, moist, and dark place suitable for microbes to grow. Cleaning prevents infection, odors, and skin breakdown and promotes comfort. Pericare is done at least once every day during the bath, and the procedure is done whenever the area is soiled with urine or stool. Clients with certain disorders require perineal care more often. Clients do their own perineal care if they can. Some may need assistance, and clients may not understand the terms perineal care or pericare, but will understand the words like private parts, crotch, genitals. Just try not to use slang words or swear words. So follow the standard and medical asepsis procedures when providing perineal care. Wear gloves. Work from the cleanest to the dirtiest. The urethral area is the cleanest and the anal area is the dirtiest, so keep that in mind. Clean around the perineum. Use warm water, not hot water. Use 3 strokes on one each sides and down the middle of the perineum, and avoid being too rough so you don't injure the area. And rinse the area thoroughly and pat dry after rinsing to reduce moisture. When washing a client who has soiled themselves, wash the buttocks area first and then the anal area. Some clients with dementia may put their hands in their briefs or put their hands in the area you are cleaning. Wash their hands first and give them something to hold on to, like a clean washcloth or towel. Make sure to report and record the following if observed when providing pericare: odors, redness, swelling, discharge or irritation, complaints of pain, burning, or other discomfort, and signs of urinary or fecal incontinence, as well as the presence of hemorrhoids. A male client's foreskin not retracting is also something to report and record. Some things to keep in mind. Ask the patient what else you can do to make them more comfortable. Emphasize how important bathing is, not only for their physical health and skin integrity, but also for their energy levels and sense of cleanliness. Do whatever you can to maintain the patient's dignity, and assume they will want a blanket to cover up with whenever possible, and they will want some privacy when dressing afterwards. Remain tactful and positive to put their mind at ease, and you can make conversation with the client to help them feel more relaxed. Ask them to play an active part in the bathing process if they are able to. For example, many people will be able to use a washcloth to clean their face. If this is the case, allow them to do so. This will give them a sense of independence and restore their dignity, since this shows that you can recognize their remaining abilities. Additional care. That's skin care, nail care, shaving, and mouth care. So with skin care, it's important to care for the patient's skin and maintain good skin integrity, and this could include repositioning the client to prevent pressure points, shearing, or friction on the skin surface to avoid skin breakdown. Report any and all changes to the patient's skin appearance, assess for reddened areas that may develop into pressure sores, and report any unusual signs of redness or infection. When it comes to nail care, this includes cleaning and maintaining the client's nails at the reasonable length, filing and smoothing rough edges using a nail file, and make sure to avoid trimming nails, especially when a diagnosis of diabetes, vascular impairment, or blood thinner medications are present, as this can cause poor circulation to the extremities. A cut or nick to a poor circulated extremity may not heal and result in an infection. When shaving of facial hair, armpit, or leg should be done, it should be done with an electric razor or disposable razor. A support worker should never use a straight edge razor, so the requirement of shaving for a client should be listed in their care plan. Good oral hygiene keeps the mouth and teeth clean, which prevents mouth odor infections, gum disease, and tooth decay. Mouth care includes teeth brushing, denture care, mouth swabs, and this will facilitate better food tasting and increase overall client comfort and oral health. Light housekeeping. So at FirstLight Home Care, clients may not only be required the PSW or the support worker to perform personal care, but also light housekeeping and meal preparation. Let's go over what light housekeeping includes. It includes clearing away dishes after meals, hanging up towels and washcloths to dry in place or in the laundry, cleaning the sink, bathtub and toilet after use, wiping down spills and sanitizing surfaces, changing bed linens, dusting off surfaces, tending to houseplants, taking out the trash, cleaning up clutter, sweeping and vacuuming floors, organizing closets and drawers, and doing laundry. What is not included in light housekeeping are moving furniture, washing windows, scrubbing carpets and floors, shoveling snow, mowing the grass, and raking leaves. So make sure to keep this in mind when it comes to a client requesting for you to, for example, scrub the carpets or the floors. You can kindly refuse and say that this is not part of your tasks or duties for light housekeeping. Let's go over medication safety. So, personal support workers or any support workers are allowed to assist clients in the administration of oral, topical, and transdermal medications. Transdermal medications are medications that go on top of the skin. Assisting usually refers to listening to the clients and helping them with the medication-related task that they may ask for. Keep in mind that support workers are not allowed to administer medication, but are allowed to assist. For example, if a client is asking you to help them open up a prescription bottle, you may do so. However, you may not take out the medication from the bottle or pour it out and give it to the client. The client has to do that themselves. If you have any questions, please connect with your nursing supervisor. Let's go over anaphylaxis. Anaphylaxis is a severe sensitivity to an antigen or allergic reaction that occurs rapidly and causes a life-threatening response involving the whole body. The reaction can lead to difficulty breathing and shock and can ultimately lead to death. Anaphylactic shock can occur within seconds. So let's review the signs and symptoms. Severe restlessness, increased anxiety, possible combativeness from struggling to breathe, sweating, shortness of breath, low blood pressure, irregular pulse, respiration congestion, swelling of the larynx, hoarseness, and dyspnea.
Come in.
Good evening, Mary.
Oh, hello, Lindsay.
How are you today?
I'm grand, thank you.
No, I'm here to
Fine.
help you settle for the evening.
Oh, that's good.
Have you
that's
taken
good.
your medication this evening?
No, and I wonder, could you go through to the kitchen and get them for me?
Certainly. Where are they?
Up above the cupboard, up above the kettle. And there's a wee bottle, that's my painkillers. Could you bring them too?
No problem. Have you had a good day, Mary?
Oh, a fine day. Yes, thank you.
Good.
Yes. Oh, my knees are a wee bit stiff, but
Okay.
a lot better than they were.
Here's some water for you. That's what you asked for. And here's your Dorset box.
Thank you. Now, here we are, Monday night again.
That's right, Monday night.
Oh, I'll need a hand here, Lindsay. Could you just push that through for me?
Certainly.
Monday night, remember?
Monday night. Now that should make it a bit easier for you.
Thank you. That's it. Now. And I know I can't open this. Can you just slacken this a wee bit for me?
Certainly, I
Good.
can. There we go.
This is my 2 painkillers. Thank you. If you just put the top on again. No, that's it.
That's it done. That's great. We'll just get your file updated, Mary, and then we can get ready for bed.
Lindsay, if you manage to just put these back through for me, please.
Certainly. Do you just want them back in the same cupboard?
Just the cupboard up above the kettle.
Right. I'll just put these back, Mary, and then we'll come back and get you ready for your bed. Hi Valerie, it's Kate.
Oh, hello, Kate.
How are you this morning?
I'm grand, thank you.
I've arrived on fine and early, so we get you ready for your doctor's appointment at
Perfect.
10.
I'm just nearly there.
And have you taken your tablets?
I haven't. I was going to wait, get my bag sorted and wait.
Well, if you get yourself organised, I'll go and get a glass of water for you.
Thank you.
A lovely morning it is, Valerie.
Beautiful, isn't it?
Now, remember it's Monday morning?
Yes, well, I won't forget because I had a lovely Sunday lunch yesterday.
Oh, how lovely. Did your daughter manage to come in and pick you up?
She did. It was lovely. I'm still
Good.
full up.
Good.
I won't need much to eat today.
Okay.
Oh, sometimes this is hard.
That's it.
No,
There we go.
that's us.
That's it. Here's your water.
No.
Well done. I'll just write that in your file and then we can get going. Now Valerie, I'll go and get your jacket and we can get into the car and get going.
Perfect. Thank
Okay.
you.
So make sure to keep this in mind. Let's go over vision and hearing aid care. The PSW should explain what they are about to do before they do the task. This does not only refer to PSWs but also any support workers. Allow the client to assist as much as possible. Always indicate your presence by speaking to the client when entering and leaving the room. Keep the doors closed or wide open to prevent accidents. Do not rearrange furniture or client's belongings without letting them know of the changes. And when serving the client their food, always explain what you're serving them and place the food in the manner in the example of numbers on a clock. For example, tell the client that their egg is at 3 o'clock. Always allow the client to take your arm when walking. Always tell the client where the phone, furniture, and household items are. Read to the client if they desire. And always offer the client encouragement and praise to promote the feeling of independence. Never infantilize the client. Catheter care. If you see in the picture, there is a bag at the bottom of the bed and a tube that goes up to the client's leg. The urine Foley catheter is a tube that helps drain urine from the bladder, and urinary catheter is held in place by the bladder in the bladder by a small water-filled balloon. And the leg bag, which is a small bag, is typically used during the day to be drained more frequently, whereas the larger bag is typically used during the night. So, how to attach or remove the drain bag. This is something that you will need to know in case your client has a catheter in place. So make sure you perform proper hand washing. Place a towel under the connection between the catheter and the bag. Pinch the soft rubber tube, which is the catheter tube. so that the urine does not leak out. Disconnect the catheter tube from the current bag with a twisting motion while pinching the tube. Be careful not to pull on the catheter and place the current drainage bag on the towel. Prepare to place the new drainage bag by cleaning the tip with an alcohol pad and wiping away from the opening to avoid getting the tube dirty. Insert the tip in the catheter tube, and if attaching a leg bag, fasten the leg bag to the client's thigh. So secure that with the leg straps or tape it if the leg straps are not available. Ensure that you don't put too much pressure on the bladder, urethra, and other parts of the body. And do not fasten the straps or tape too tightly to prevent poor circulation. If attaching a regular bag, the client will have a place for this to be hung by the client's bed overnight. To continue, let's go over how to empty the leg bag. Empty the leg bag when it is half full or at least twice a day. Follow the instructions on how to remove the bag, which is to empty the urine into the toilet and observe any unusual odor and discoloration. When the bag is empty, close the clamp or twist the cap on the bag and perform proper hand washing. Document observations and amount of urine in the progress notes. To clean the bag, you have to rinse out the used drainage bag with 1 part vinegar and 3 parts water. Soak the bag for 20 minutes, then rinse out the bag with warm water, and then hang it upside down to dry for the next use. So make sure to keep in mind symptoms of a urinary tract infection, and those can be pain or burning while urinating, frequent urination, urgency with small amounts of urine, bloody urine, pressure or cramping in the groin or lower abdomen, or confusion and altered mental status in older adults. So make sure to keep those things in mind.
So the first thing that I'm going to do is just put on a pair of gloves. And I always tell people, look, before you, I'm going to take this off of this bed frame. I always tell people, look, before you pull this loop out, you want to make sure that this clamp is closed, okay? It's secure, because if you pull it out and the clamp is open, you're going to get urine all over the place, okay? And more specifically, it may splash on you, and you don't want that, right? So just check to make sure that the clamp is closed, and then you can go ahead and pull out the loop, all right? So I'm going to go and put this back on the bed frame so I can work with both hands. And as you see, I'm kneeling on the chucks, so I'm not contaminating my clothes. So once I'm going to go ahead and open up. In this case, I'm using a urinal. Anything that has measurements on it is considered a graduate, right? So you can use a hat. You can use any type of measuring container that has measurements on it, especially if the person is on I's and O's, right? So I'm going to go ahead and open up my urinal or measuring container. I've already checked, the clamp is good to go. I'm going to take 1 alcohol wipe, and I'm going to wipe around the tip of the tube, the drainage bag tube. Don't wipe on the inside, just wipe around it on the outside, okay? And now I'm going to go ahead and place the tube without touching, okay? I don't know if y'all can see this. Let me put it this way. I'm making sure that the tube is not touching the container, okay? Because once it touches the container, it's contaminated. And so you'll want to actually wipe it off again with alcohol. So now what I'm going to do is open up the clamp. See if I can get this bad boy opened here. And you can see, hopefully you all can see the urine is draining from the bag now. And I'm just going to tilt the bag over a little bit so I can get try to get as much urine out as I can. and it's draining. And whenever you hold it, you want to make sure you hold the tube up, okay? Don't hold it slanted. If you hold it slanted, again, you're going to get urine all over the place. Okay, and I think that it's drained as much as it could. I'm just going to milk it a little bit just by tapping the back of the drainage bag. Once I do that, I'm going to close my container, right? Because I don't want any accidents. So I'm going to close my container. Move it out the way here. I'm going to take my second alcohol wipe, and now I'm going to clean around the outside of the tube. Okay, I've clamped it. Okay, remember to re-clamp it, and then place the tubing back into the holder. All right, and there you go.
Now let's review Alzheimer's and dementia care. PSWs will provide a large amount of care for a client during the late stages of Alzheimer's disease, along with the individuals of the care team. Care for clients with this disease often require 24/7 care as they become bedridden. As the stages of Alzheimer's and dementia progress, increased and additional care will be required for the client as both cognitive and physical functions will decline. Alzheimer's and dementia care is supporting and/or assisting a client experiencing the symptoms of dementia. So the support worker level of care would require for clients requiring assistance with one or more activities of daily living. So some things to keep in mind is to allow the clients to use aids such as glasses and hearing aids if it's available or necessary for them. Make sure you speak slowly, clearly, and loudly enough to be heard, but in a low-pitched tone. Do not yell at the client to make yourself heard, and slowly and clearly explain everything you are doing for the client and include them in the decision-making process as much as possible. Provide plenty of lighting in the room to avoid sundowning behavior, and ensure that the client is warm because often clients with Alzheimer's or dementia have an internal body temperature that is much cooler than those who do not have this disease. Reduce the noise level in the environment and remind the client of the time, date, and day and repeat as necessary. Offer fluids to the client, and often clients will not take enough fluids, and they can become dehydrated, which can cause an increase in confusion. Do not make any changes in the client's home environment. The client may become more confused and agitated as a result of any change. Make sure you maintain a regular routine and follow set care plan for the client. Often give praise, reassurance, and comfort through positive reinforcement, and protect the client from wandering. Involve the client in minor activities such as folding the laundry, winding a ball of yarn, and make sure it's tolerated by the client. Most activities of daily living will have to be done for the client as the disease progresses. The safety of both caregiver and client are the utmost importance, and communication to the appropriate supervisor is imperative. Now let's review dementia behaviors and understanding them. Wandering. Patients with dementia walk seemingly aimlessly for a variety of reasons, such as boredom, medication side effects, or to look for something or someone. They also may be trying to fulfill a physical need, like thirst, hunger, a need to use the toilet, or exercise. Discovering the triggers for wandering are not always easy, but they can provide insights to dealing with the behavior. Make time for regular exercise to minimize restlessness. Try a barrier-like curtain or colored streamer to mask the door. A stop sign or do not enter sign may also help. Putting away essential items such as confused person's coats, purse, or glasses. Some individuals will not go out without those certain items. Have the patient wear an ID bracelet or sew ID labels in their clothes. Always have a current photo available should you need to report the patient missing. Incontinence. The loss of bladder or bowel control often occurs as dementia progresses. Sometimes accidents result from environmental factors. For example, someone can't remember where the bathroom is located or can't get to it in time. If an accident occurs, your understanding and reassurance will help the client maintain dignity and minimize embarrassment. Establish a routine for using the toilet and try reminding the patient or assist them to the bathroom every 2 hours. Schedule fluid intake to ensure the confused patient does not become dehydrated. Know that some drinks like coffee, tea, cola, or beer have more of a diuretic effect than others. Limit fluid intake in the evening before bedtime. Use signs, with illustration perhaps, to indicate which door leads to the bathroom. A commode can be left in the bedroom at night for easy access, and incontinence products to be used as necessary. Use easy-to-remove clothing with elastic waistbands or Velcro closures, and provide clothes that are easily washable. Agitation. Agitation refers to a range of behaviors associated with dementia, including irritability, sleeplessness, and verbal or physical aggression. Often these types of behavior problems progress with the stages of dementia, from mild to more severe. Agitation may be triggered by a variety of things, including environmental factors, fear and fatigue. Most often, agitation is triggered when the person experiences control being taken from them. So, reduce noise, clutter, or the number of persons in the room. Maintain structure by keeping the same routines. Keep household objects and furniture in the same places. Familiar objects and photographs offer a sense of security and can suggest pleasant memories. Reduce caffeine intake, sugar, and other foods that cause spikes in energy. Try gentle touch, soothing music, or walks to quell agitation. Speak in the reassuring voice. Do not try to restrain the person during a period of agitation, and keep dangerous objects out of reach. Allow the patient to do as much for themselves as much as possible, and support the patient's independence and ability to care for themselves. Acknowledge the confused patient's anger over the loss of control in their life and tell them that you understand their frustration. Distract the patient with a snack or an activity and allow them to forget the troubling incident. Confronting a confused patient may increase anxiety. Repetitive speech or actions. Patients with dementia will often repeat a word, statement, question, or activity over and over. While this type of behavior is usually harmless for the patient with dementia, it can be annoying and stressful to the personal support worker. Sometimes the behavior is triggered by anxiety, boredom, fear, or environmental factors. So provide plenty of reassurance and comfort, both in words and in touch. Try distracting with a snack or activity. Avoid reminding them that they just asked the same question, and try ignoring the behavior or question, and instead try to refocus the patient into an activity such as singing or helping you with a chore. And don't discuss plans with a confused person until immediately prior to an event. You may want to try placing a sign on the kitchen table such as dinner is at 6:30 or Sarah comes home at 5 to remove anxiety and uncertainty about anticipated events. And learn to recognize certain behaviors. An agitated state or pulling at clothing, for example, could indicate a need to use the bathroom. Paranoia. Seeing a patient suddenly become suspicious, jealous, or accusatory is unsettling. Remember, what the patient is experiencing is very real to them. It is best to not argue or disagree. This too is part of dementia. Try not to take it personally. If the confused patient suspects money is missing, allow them to keep small amounts of money in a pocket or handbag for easy inspection. Help them look for the missing object and then distract them into another activity. Try to learn where the confused patient's favorite hiding places are for storing objects, which are frequently assumed to be lost. to avoid arguing. Take time to explain to other family members and some helpers that suspicious accusations are part of this illness. Try nonverbal reassurances like a gentle touch or gentle hug, and respond to the feelings behind the accusation and then reassure the patient. You might try saying, "I see this frightens you. Stay with me. I won't let anything happen to you." Sleeplessness and sundowning. Restlessness, agitation, disorientation, and other troubling behavior in patients with dementia often get worse at the end of the day and sometimes continue throughout the night. Experts believe this behavior, commonly called sundowning, is caused by a combination of factors such as exhaustion from the day's events and changes in the person's biological clock that confuse day and night. So, increase daytime activities, particularly physical exercise. Discourage inactivity and napping during the day, and watch out for the dietary culprits such as sugar, caffeine, some types of junk food. Eliminate or restrict these types of foods and beverages too early in the day, and plan smaller meals throughout the day, including a light meal such as half a sandwich before bedtime. Plan for the afternoon and evening hours to be quiet and calm, however structured. Quiet activity is important. Perhaps take a stroll outdoors, play a simple card game, or listen to soothing music together. Turning on lights well before sunset and closing the curtains at dusk will minimize shadows and may help diminish confusion, and at minimum, keep a nightlight in the person's room, hallway, and bathroom. Make sure the house is safe and put away dangerous items. It's essential that you, the personal support worker, get enough sleep.
If you're caring for someone with dementia, you may have noticed that near the end of the day, they sometimes feel confused, restless, or agitated. This behavior, known as sundowning, can be a scary experience for the person you're caring for, and might also cause you to feel overwhelmed as their caregiver. In this video, we'll look at a few of the things that cause sundowning and give you some helpful tips on how to manage it. There are a number of factors that may contribute to sundowning. Some of them could be related to the habits and physical needs of the person you are caring for, while others might have to do with their environment. Here are a few questions you can ask yourself to help identify what may be triggering their sundowning. Do they seem mentally and physically tired by late afternoon? Are they often up during the night and asleep during the day? Are they receiving too much daily stimulation or not getting enough? Do they seem to be struggling with physical issues like hunger, dehydration, constipation, or pain? Does the lighting in their living space create shadows that might cause confusion or hallucinations? Could they be picking up on the stress of others, including yourself? If you answered yes to any of these questions, you may have discovered one or more of their sundowning triggers. Now that you know what to look for, here are a few tips that can help you manage the effects of sundowning on the person you are caring for. Keep track of their activities, behaviors, and environment to look for patterns that could be making things worse. Stick to a regular routine, scheduling activities earlier in the day and encouraging them to rest in the afternoon. Check in regularly about their comfort levels regarding hunger, pain, and the need to use the bathroom. Limit their caffeine and alcohol intake and try to plan larger meals earlier in the day. Provide more lighting to help reduce the amount of shadows in their living space after dark. Get them to join in a simple breathing exercise to help calm them down. Sit together and slowly inhale through your nose, then exhale through your mouth for 5 deep breaths. If they get restless, take them for a walk or drive with the help of someone else they can trust. When it's time for bed, try closing the curtains, turning on a nightlight, or playing soft music to make it easier for them to fall asleep.
If you're caring for a person with dementia, you may have noticed that they sometimes respond to situations in unexpected or inappropriate ways. These reactions are called responsive behaviors, and although they can be confusing or even scary to see, it's important to understand that they're happening for a reason. A responsive behavior is a reaction to something that the person you're caring for is having a hard time expressing. When a responsive behavior happens, remember that the person you're caring for isn't trying to be difficult, they're having difficulty. Even though it may be hard, try not to take their words or actions personally. They're directed at the situation, not at you. Responsive behaviors can show themselves in all sorts of ways. Sometimes they're verbal. The person you're caring for could yell, curse, or call you names. Other times, they can be physical. When it comes to dealing with a responsive behavior, your own safety is key. If you feel like you're unsafe or in danger, don't be afraid to leave the area. The most helpful way to control or stop a responsive behavior is to figure out what's causing it and try to remove the trigger. Although it may not always be possible to understand the cause of a responsive behavior, shifting your point of view is a good place to start. Let's take a look at some of the most common types of responsive behaviors and the best ways to help manage them. Agitation is a responsive behavior that can involve fidgeting, wandering, picking at one's clothes, or general restlessness. If the person you're caring for seems agitated, try giving them something to hold, distracting them with conversation, or taking them for a walk. Ask yourself if they're tired, too hot or cold, need to use the bathroom, or if the noise and lighting levels could be making them uncomfortable. Try not to get frustrated with them or raise your voice, and don't tell them to calm down or stop what they're doing. Sexual behavior is another common responsive reaction. This can be distressing to witness, especially for young caregivers taking care of a parent. People with conditions like dementia have less control over their urges and often don't understand social norms. Although you may find their actions shocking, as long as they aren't hurting anyone, you should try to give them privacy and avoid scolding them. If privacy isn't an option, like when you're helping them bathe, try to distract them by giving them something to hold, like a washcloth or shampoo bottle. Sometimes what you might think of as a sexual responsive behavior is actually something else. Perhaps their clothing is too tight, they're too warm, or they need to use the bathroom. Look for possible triggers and do your best to remove or adjust them. Another common responsive behavior is repetition. The person you're caring for might ask the same questions over and over, or repeat the same words or movement. This can be difficult to handle as a caregiver, as they may be asking about a loved one who they've forgotten has died. Try to think of things you can do that can help soothe their emotions, like reminiscing, looking through photo albums, or distracting them with a conversation about another topic. Avoid telling them to stop or reminding them that their loved one is deceased, since this can start the grief process all over again. Hallucinations and delusions are also responsive behaviors. The person you're caring for may begin seeing things that aren't there or believing things that aren't true. Do your best to understand where they're coming from, and as long as they aren't in any danger, try not to intervene. Even though you know that what they're seeing is a hallucination, it's very real to them, and saying that it isn't there might just confuse them more. Sometimes, if hallucinations begin suddenly, they can be a sign of infection or a side effect from a new medication. Talk to their doctor if you think this could be the case. There's no perfect solution for responsive behaviors, so use trial and error, and try your best to be understanding. Responsive behaviors are a lot to deal with, but by learning to look for triggers and responding appropriately, you'll make things easier on both yourself and the person you're caring for.
These folks will present unique challenges to your caregiving. What we want to focus on now is building your skills, teaching you ways to be successful when you work with people with dementia. What we're going to do now is work on some skill building. And Thaddeus, if I could have you come up and join me in the chair. As we've sort of given you the hint, the big change that you're going to have by the end of the day is how you interact. Okay? And we're going to start off with your approach, because how you approach people makes a big difference in what happens next. One of the first things that we sometimes do with people with dementia is we come up from behind them and we'll just touch them. Okay? Or let me just do something for you here. That is, how's this working for you?
Okay. It's okay.
It's okay? You okay with that? All right, you're doing all right? Not bothering you at all?
Not yet.
Not yet? How long would it take?
Just a little while.
And what would you feel like doing? What do you sort of feel like getting away? Okay. Human beings are pretty much hardwired to protect themselves. And one of the things we don't like is when things come up and we can't see them coming. It makes us very uncomfortable. Okay. And it actually elicits an automatic reaction. Okay. It's called flight, fight, or fright. Okay. Now, imagine instead of being in a nice, comfortable classroom, we're in a dark part of town, late at night, you've locked your keys in your car. You start to hear and feel something come up behind you then. Now what?
Yeah. Now I just want to run.
Now you just want to run, okay? And some folks tend to be more flight people, fight people, or fright. If you're a fight person, what's going to happen? going to turn around and get popped or yelled at, that kind of thing. What if you're a flight person? They're going to take off, okay? And what if you're a fright person? You just totally freeze up. And you will see people literally, when they're approached and they have dementia, they'll latch onto a chair and they can't let go. And that's fright. That's just pure fright. So let me do one more thing here. Hey, Thaddeus.
Hey, Tupa.
Do I look as good as I think I do? No. And the reason I don't is I'm too close. I'm at a funny angle. My eyes are tipped to the side. And it's really difficult to sort of figure out what's going on here. When might this happen? When can you see this sort of happening?
Wheelchair? Or?
Wheelchairs. You come up behind people in wheelchairs? Yeah, where else?
At a table.
At a dining table. Yeah, that happens a lot. I recognize Thaddeus and I say, hey, Thaddeus, how you doing today? And with lack of impulse control, I might get myself in trouble. So the first rule on approach is always come from within visual range. Always approach where they can see you. Give them a chance to know you're coming. So you want to come from the front so that they know you're coming in. Now he can process the information, sort of figure out, oh, there's somebody coming, if he's capable of doing that, if his brain's still able to do that. Now pull your feet back, Thaddeus, for this next one. Okay, you ready? All right, you ready? You sure you're ready? Okay. He was ready. What happened?
We all kind of went back.
Y'all kind of went back in sympathy, right? Coming in too fast, not giving him time to figure out what's going to happen results in, Thaddeus already told us, he tends to flight. He wants to get away. So what was he doing? Trying to get away. Now, somebody who tends to be a fighter, what might I see? Push me back away or grab me and try to shake me or do something to me. Who started it? I did. Okay? I came in too fast. Now, I'm not saying that caregivers race up, but in the mind of somebody who is damaged with Alzheimer's disease, it feels like you're coming in really fast. The other thing I do is, okay, Thaddeus, let's get those shoes off, because, come on, pull your, Thaddeus, come on now, let's get your, okay, because I know what I want to have done, and I never check in with Thaddeus and make sure he knows what I want to do. And so what happens is conflict, because I came in too fast. So the rule is come from the front, okay? Second rule is go slow. And it's 1 second, 1 step. So it's 1 1,000, 2 1,000, 3. It gives him a chance to figure out what's going on. Okay. Now, we've come from the front, we go slow, still have an opportunity to ruin it. I'm going to stand right in front of him, and I'm going to smile real big. How's that working for you, Thaddeus?
Kind of awkward.
Kind of awkward. Uh-huh. Yeah, what about if I do this?
No, I think I've done something wrong.
How about if I do this?
I know I've done something wrong.
Yeah, because it takes you back to those days. This stance is actually called confrontational stance. Think about it in real life. When do you use it?
It's when you're disciplining a
When you
child.
want to get in somebody's face. You really are like trying to gain intimidation. Is that what we want to do with people with dementia? No, because it's going to call that kind of response that we don't want to see, which is the anger, the lack of impulse control. So instead of getting right here in confrontational stance, I want to move to the side. Feel different?
Yeah, you're more kind of where I can deal with you on my own terms.
What if you don't like what I'm saying? What can you do?
You just turn away.
Yeah. This stance is called supportive stance. Okay? I'm here to support him. Now, I want to maintain arm's reach. I don't want to be like this, because we're back to the same old problem. Arm's length, so that I could reach out like this. He feels a lot more comfortable with that. I'm less likely to get that automatic reaction. Okay? So to put it together so far, come from the front, nice and slow, and come to the side. Feel better?
Much.
You sure?
It was much better over there.
Much better over there, yeah. The other thing you'll notice is he smiled. Did that mean he was happy? No. What was it?
I was comfortable.
Yeah, that nervous kind of, it's sort of, you'll see people with dementia do that a lot with caregivers. They'll smile and they'll, doesn't mean they're happy. They're anxious and nervous and they're trying to figure out how to make this work. Now, here I am to the side, looks pretty good, but I want to get to eye level, right? What do you think?
You're too close.
Too close, too close. So bending over to get down doesn't work. What does work, however, hey, how's that feel?
It's much better because it's lower.
Who feels like they're in control?
I do.
That is.
Who's in control?
You are.
Yeah, but did I actually give up anything here? But I did, because that Thaddeus feels in control now. Who's more likely to cooperate with me?
I am.
Yeah, absolutely. I still have one more chance to ruin it here. Let me grab hold of him. Come on, let's go. What's the automatic reaction? Pull back. I want to make my job more difficult because it's not hard enough. That's a facetious question. What I really want to do is think about, how can I get him to work with me? So instead, what I'm going to do is offer my hand out here and let him take my hand. Hey, who's more likely to cooperate with me? Somebody who's offered his hand or somebody who's been taken? Offered their hand, because that signifies an interest in participating. So if I put it together, it's going to look like something like, come from the front, go slow, get to the side, get low, offer your hand. Now I want to call the person by name, okay, to make sure he's connected with me.
And what we need to know, what everybody needs to learn how to do is de-escalate people. But guess what that requires you to be able to do? Communicate effectively. Because now I have somebody in acute distress. Unless you know how to take them down verbally and non-verbally, all you're going to do is increase their distress, which is typically what happens, which is why they end up with the EMS people, strapped them down to the gurney and have to drug them up, quote unquote, because they reach maximum crisis. I walked in on a Saturday into a building one time. I was there to train staff, but nobody was in the place I was supposed to do training, and I heard down the hall, "No! No! You got away! I'll kill all of you!" And I thought, well, I bet I know where everybody is. And I went down the hall, because of course when there's a racket, everybody wants to check it out. And so everybody was down there checking out the racket. Basically everybody who was supposed to be in my class, I suspect. And there was a woman backed into a corner, and there were 4 EMS folks who were trying to move in on her, and staff said, "This is what we're talking about. She gets totally out of control." And they were all saying, "Calm down." Now turn to your partner. I want you to do this one. This one's a really popular one. Do this. Calm down. I need you to calm down. Calm down. And I said, gentlemen, stop. Come here. I will handle this. I'm an expert. Now I'm going, oh crap. I hope I can do this. But what did I know if I chose not to do it? She was already flinging her arms around. She had a cut on her arm from where she flung against the edge of the wall, and it sliced her skin because she was 89 years old. She was terrified. She was fighting them off, but she missed them and hit the wall because she didn't have depth perception. She was crouching down. She was trying to find things to throw. It was just going to get worse and worse. And I said, enough, time. And I pulled everybody back, and I said, you guys back off. Quit watching. It's not a show. And they were all like, and then they hid so they could watch. I know what they did. Fortunately, they just got enough out of her range, and I didn't really care. And I said, what's her name? And they said, Millie. And I said, Millie, oh, these people, all these people, every one of them is coming at you. Now notice what I did. That's Millie, and I turned this way. Who's on Millie's side? You are. I am, and I did what she was trying to do, only I was her champion. None of them. No, you get out of here. All you people, leave her alone. Oh, Millie. Oh, man, I can't believe they did this. Oh, God, are you okay?
I got goosebumps.
Yeah, because what do you want to do right now? What are you planning on doing right now? Absolutely taking my hand. Oh, my God, I cannot believe this has happened. Oh, are you okay? Oh, Christ. Oh, God. Millie. Good. There we go. There we go. There you go. There you go. You're okay. It's okay. You're okay. I'll deal with them. Come on. Let's go sit down a minute. Come on. We'll be okay. So she got up. I had her walk over to the gurney, sit down on the gurney. I helped her lie down on the gurney. I said, I'm going to put this strap here to hold you on. Okay? Okay, she said, yeah, put it on. And I said, now I'm going to do one down here because I don't want your legs to come off. Okay, but I put the blanket up real high because you're cold. Why was she cold? Her anxiety was so high, she was freezing. She was freezing because she'd just been through this horrible incident. And so what happened is I said, here, come on, I'm going to hug you. I'm going to hold your hand. And I walked out with her. She got in the emergency vehicle, no problem whatsoever. They're like, how did you do that? Were you watching? I was willing to go where she was. She was a terrified, trapped person. And what they didn't realize is they were making it worse in their effort to help, because they're trained to do what they're trained to do, which is transport people emergently. And some of them go further and they've got more skill, but that's not what their job is until we make it their job. Your job is to help people who have dementia.
Eating and nutrition. Ensuring that the patient is eating enough nutritious food and drinking enough fluids is a challenge. Patients with dementia literally begin to forget that they need to eat or drink. Complicating the issue may be dental problems or medications that decrease appetite or make food taste funny. These consequences of poor nutrition are many, including weight loss, irritability, sleeplessness, bladder or bowel problems, and disorientation. So make meal and snack times as part of their daily routine and schedule them around the same time every day. Instead of 3 big meals, try 5 or 6 smaller ones. Make meal times a special time. Try flowers or soft music. Turn off loud radio programs and the TV. Eating independently should take precedence over eating neatly or with proper table manners. Finger foods support independence. Pre-cut and season the food, and try using a straw or child's sippy cup if holding a glass has become difficult. Provide assistance only when necessary and allow plenty of time for meals. Sit down with the patient, and often they will mimic your actions, and it makes the meal more pleasant to share it with someone. Prepare foods with patient in mind. If they have dentures or trouble chewing or swallowing, use soft foods or cut food into bite-sized pieces. If chewing and swallowing are issues, try gently removing the patient's chin in a chewing motion or slightly stroking their throat to encourage them to swallow. And lastly, if loss of weight is a problem, offer nutritious high-calorie snacks between meals. Breakfast foods high in carbohydrates are often preferred. On the other hand, if the problem is weight gain, keep high-calorie foods out of sight. Instead, keep handy fresh fruits, veggie trays, and other healthy low-calorie snacks. Other problem areas would be dressing, as it becomes difficult for most dementia patients. Choose loose-fitting, comfortable clothes with easy zippers or snaps and minimal buttons, and reduce the person's choice by removing seldom-worn clothes from their closet. It's common for people with dementia to continue layering on clothes even though they are fully dressed. To facilitate dressing and support independence, lay out one article of clothing at a time in order it is to be worn. Remove soiled clothes from the room, and don't argue with the person if they insist on wearing the same thing again. Another thing is hallucinations, seeing or hearing things that others don't, and delusions, which are false beliefs such as someone is trying to hurt or kill another, may occur as the dementia progresses. State simply and calmly your perception of the situation, but avoid arguing or trying to convince the person that their perceptions are wrong. Keep rooms well lit to decrease shadows, and offer reassurance and a simple explanation of the curtains move from circulating air, or if a loud noise such as a plane or siren is heard. Distractions may help. Depending on severity of symptoms, you might consider medication. This is something to be discussed with the family physician, of course, so please make sure to report any of such. Sexually inappropriate behavior such as masturbating or undressing in public, lewd remarks, unreasonable sexual demands, even sexually aggressive behavior may occur during the course of this illness. Remember, this behavior is caused by the disease, and develop an action plan to follow before the behavior occurs. What you say and do if the behavior happens at home, around relatives, friends, or paid personal support workers, or any other members of the team. And if you can, identify what triggers the behavior. So if such things happen, Please remove yourself from the situation and maybe distract the patient or distract the client into doing something else or discuss something else. Verbal outbursts such as cursing, arguing, and threatening often are expressions of anger or stress. React by staying calm and reassuring, and validate the patient's feelings, and then try to distract or redirect his attention to something else. Shadowing. This is when a person with dementia imitates and follows the support worker or constantly talks, asks questions, and interrupts. Like sundowning. This behavior often occurs late in the day and can be irritating for support workers. Comfort the patient and with verbal and physical reassurance, and distraction or redirection might also help. Giving the patient a job such as folding the laundry might help to make her feel needed and useful. Patients with dementia may become uncooperative and resistant to daily activities such as bathing, dressing, and eating. Often this is a response to feeling out of control, rushed, afraid, or confused by what you're asking of them. Break each task into steps and in a reassuring voice, explain each step before you do it. Allow plenty of time and find ways to have them assist to their ability in the process or follow with an activity that they can perform. Even with these potential challenges, it's important to remember that these behaviors are often coping tactics for a person with deteriorating brain function. There's no question that dealing with these behaviors can make providing care especially challenging. Now let's go over older adult and their sexuality. Love, affection, and intimacy are needed throughout life, as sexuality is part of the whole person. These needs do not disappear. Some older people are not able to have sexual intercourse, but that doesn't mean that their desire has gone. They can express these needs through hand-holding, touching, caressing, and embracing. Members of the healthcare team must respect their client's sexuality and allow and promote ways to meet their sexual needs. Respecting and promoting the client's sexuality. Respect your client's clothing and grooming routine. Accept the client's sexual relationships. And allow privacy. Make sure you knock before entering a room. Alright, ambulations and lifts and transfer. So let's go over proper body mechanics. Body mechanics involve standing and moving one's body so as to prevent injury, avoid fatigue, and make the best use of strength. When you learn how to control and balance your body, you can safely handle and move another person. Back injuries to care providers are common, so when doing any lifting, be sure to use proper body mechanics. Let's go over the key points of proper body mechanics during transfers. Make sure to never lift more than you can comfortably handle. Create a support base by standing with your feet 8 to 12 inches, which is shoulder width apart, with one foot a half step ahead of the other. Do not let your back do the heavy work. Use your legs. If the bed is low, put one foot on a footstool, as this relieves pressure from your lower back. Consider using a support belt for your back as well. Make sure you are not twisting your back. You should be pivoting your feet, which is turning on one foot instead of twisting your body. Breathe deeply and keep your shoulders relaxed. When a lot of assistance is needed with the transfer, you can use a gait belt around the patient's waist and hold it as you complete the transfer. You can also tell the person what you're going to do, and you can count from 1, 2, 3 before stating move. So, lastly, to feel in control, get close to the patient. While lifting, keep your back in a neutral position, knees bent, and weight balance on both feet. Tighten your stomach and back muscles to maintain a correct support position. Use your arms to support the patient. Remember to encourage independence and let the person assist as much as they are able to, and it's okay for the person to stand up partly and sit back down. Ambulation, lifts, and transfers. So make sure you know your lifts. Before using a lift, check to see if the patient can assist with the transfer. Check the client's weight and physical condition. Make sure you have the correct lift, and ensure the lift will not make the client's conditions worse. Assess the client's mental status. Ensure the client is able to understand and follow instructions, and make sure that the client is ready to be placed in the lift. Avoid using the lift if the client is agitated, resistant, or combative, and disinfect slings after every use. So it's very important for you to be trained using lifts. So if you have not been trained in person using lifts and you are required to for a specific client, you will be scheduled to do training with an occupational therapist by your care coordinator. The training won't happen unless it is required for a specific client. Exercise. It's important to promote exercises that because this restores the client's range of motion without causing pain, and range of motion exercises may be a part of the client's care plan aside from normal body movements, and it's your role to cue and encourage the client to perform prescribed exercises. So assist the client or the resident for muscle exercises. Present a safe environment, such as having the bed rails up or bed in a down position, important items close by. Execute activities that are active and passive range of motion exercises to all extremities. Let the client accomplish tasks at his or her own pace, and don't hurry the client or the resident, and encourage their independent activity as able and safe. Give possible reinforcement during the activity, and the client and resident may be unwilling to move or initiate new activity because of fear of falling. So keep that in mind. Turn and position the client every 2 hours or as needed. Add or to gaining enhanced sense of balance and strength, and it strengthens the compensatory body parts. This also increases the venous return and prevents stiffness and maintains muscle strength and stamina. It also avoids contracture deformation, which can build up quickly. This is to boost the patient's chances of recovering and to increase his or her self-esteem. Position changes optimizes circulation to all tissues and relieve pressure.
Today, Carol and I will be teaching you how to help residents safely move from one place to another. The first thing we will go over is how to help someone safely stand from a chair. Firstly, you need to introduce yourself to the resident and explain what the objective is.
Hi Carol, my name's Karen and I'm going to help you stand up today.
Next, you'll want to ask the resident to move closer to the edge of the chair so that they can plant their feet firmly and completely on the floor. You can then ask the resident to hold on to the armrests of the chair. Finally, you'll ask the resident to lean their chest forward so they can be ready to stand up. To give the resident some more support, place one hand on their shoulder and one hand on their lower back. Ask the resident to stand up on the count of 3, so your timing is the same.
Okay Carol, on the count of 3 we're going to stand up. 1, 2, 3, up.
Ask them to use their arms to help push up and off the chair. As you walk, support the resident by having one hand on their lower back or just above it. If the resident uses a walker, you will want to park the walker in front of the resident while they are seated and make sure both brakes are on. Repeat the same process with the resident. Once they are standing, the resident can take their brakes off. When walking with a resident, you'll want to keep one hand on the resident's lower back for support and reassurance. One hand can be kept on the walker to help the resident steer or to show them the way. It is not advised to walk in front of the resident or pull on their walker, as you can't see what's going on or if you're moving too fast. When you have arrived at your destination, help the resident sit by putting on their walker brakes. Ask the resident to reach for the armrest behind them and help the resident to slowly lower themselves into the chair on the count of 3 by having one hand on their shoulder and one hand on their lower back. If the resident would like you to give them a lift to an activity while sitting in a wheelchair, here are some things to keep in mind. Ask the resident to bring their bottom as far back in the wheelchair as possible and lean back. This will prevent them from leaning forward and possibly falling. Make sure that the footrests are locked into place and the resident's feet are not too far forward or making contact with the floor. It is very important to go slowly when pushing someone in a wheelchair, as a resident's perception of speed can be different than ours. Try to maintain a speed that seems like a leisurely stroll to you. With this information in mind, you'll now be able to help a resident move safely from one place to another. Please remember not to assist someone if you're unsure how to do so safely, and always ask a team member for help if needed.
Alright, so for progress notes, things about progress notes is that they act as proof of service delivery. They also constitute a legal record, and this record may be used in legal proceedings, audits, and investigations. They also provide a trail in case of conflict or difficult situations. They are a link to service to care plans and help in preparing and review and updating their care plan. They are also information that is shared between care providers and family members. So keep in mind to make sure that your progress notes have the following, which is care provider's name, which is your name, as well as the date and time of the service. If any details are of any reportable incidents or alleged incidents, including those involving peers of others, visits from family members, health professionals, and or other service parties or members of the community, changes in emotional well-being of the client, care interventions and assistance provided, any participation in activities by the client, behavior concerns, so state what happened before, during, and after, reactions to any medication, concerning changes in physical appearance, meals, and any dietary notes. So keep in mind that progress notes are not currently a part of the app with FirstLight Home Care. So in the meantime, these things are something you should be reporting to your care coordinator, especially if there are any reportable incidents. So important guidelines to consider: recorded at the end of every shift, not before or later. So if there's anything important that a care coordinator needs to know, please report that. Include both positive and negative occurrences. And record any errors made on your end. And record details of any incidents. So also be specific and objective. Keeping in mind that as previously explained, this is a trail to any incident, so keep your progress notes as detailed as possible and report to your care coordinator. Now let's go over falls prevention. Patient falls are the most reported client safety events, and falls are a major priority in healthcare. And healthcare providers are responsible for identifying, managing, and eliminating potential hazards to patients. And older adults may be at increased risk for falls due to impaired mental status, decreased strength, impaired balance and mobility, and decreased sensory perception. Other patients may be at risk due to gait problems, cognitive ability, visual problems, urinary frequency, generalized weakness, and cognitive dysfunction. Specific treatments and medication may cause hypotension or drowsiness, which increases a patient's risk for falls. Some prevention strategies. So look for fall risk factors in all patients. Identifying specific factors help you implement specific preventative measures. So this includes age, weakness on one side, use of mobility devices, history of dizziness or lightheadedness, low blood pressure, and weakness. Make sure to follow appropriate transfer guidelines, as these provide a good baseline for further client risk assessments. Orient the patient to their surroundings, for example, to their bed, the location of the bathroom, and any tripping hazards in the surrounding environment. Answer call bells promptly if you are in a facility. Long wait times may encourage unstable client resident to ambulate independently, and ensure basic elimination and proper needs are met. Providing opportunities for the client to use the bathroom will prevent opportunities to fall, if so. Communicate with your client and let them know when you will be back and how you will help them to ambulate. Keep the bed in the lowest position for sedated, unconscious, or compromised clients. Keep bed in the lowest position for sedated, unconscious, or compromised clients. Avoid using side rails with a client who is confused. Side rails may create a barrier that can easily be climbed and create a fall risk situation for confused clients. And finally, keep assistive devices and other commonly used items close by. Allow the clients to access devices quickly and safely. Items such as the call bell, water, and tissues should be kept close by to avoid excessive reaching. Alright, so now let's go over 3 main goals of hospice or palliative care. To assist in controlling the pain and symptoms of illness, to ensure that death is a natural process, and to provide compassionate care. So when you have a client who is palliative, these are the main goals for you to keep in mind in providing care for these clients. Okay. So your role as a PSW or home support worker in palliative care and death of a client are as follows. So emotional, social, intellectual, and spiritual needs. People need to have accurate information in order to make informed decisions. Some people want to be left alone and some people don't. Often clients prefer to talk at night. So listen, let the client share their concerns and worries with you. Don't worry about needing to respond or saying the wrong thing. Sometimes the client just needs someone to be there. If the client needs guidance, medical information, spiritual guidance, etc., inform your supervisor immediately. It's not your job to give clients information about their medical conditions. Touch. Touch, along with silence, is a powerful, compassionate way to communicate. However, keep in mind some clients may not want to be touched. Always show respect for your client, even if they share thoughts that differ from your spiritual and religious beliefs. Physical needs. Death may take minutes, hours, days, or weeks. Encourage the client to do as much as they can, but as the client weakens, more help will be needed. So let's go over the physical needs in palliative care. Pain relief and comfort. Medications are administered to help the client, and other measures like back massages, imagery, or soft music and other relaxation techniques. Comfort and positioning. Frequent position changes and supportive devices promote comfort. Semi-Fowler's position is best for easing breathing problems, and ask the client which position is the most comfortable position. Vision and eye care. At the end of life, vision blurs and gradually fails. A dark room may be frightening for a client, so keep the room well lit if the client wishes. If secretions develop in the corners of their eyes, provide eye care according to the care plan. Hearing. One of the last functions to be lost. Many clients, even unconscious ones, are able to hear until the moment of death. Always assume that the client can hear. Introduce yourself and give explanations about their care. Speech. Speaking may be difficult. Avoid tiring your client out with a lot of questions. If need be, ask yes or no questions. Mouth care. Oral hygiene promotes comfort. Frequent oral care is given as death nears and the client has difficulty taking fluids. Sores can develop as mucous membranes become very dry. Offer ice chips or small sips if the client has a dry mouth, and apply moisturizer to relieve dry, chapped lips. Nostril care. The nostrils may become crusted and irritated, usually by nasal secretions, oxygen cannulas, or nasogastric tubes. Clean the nose carefully and apply lubricant as directed in the care plan. Skin care. Circulations to the arms and legs slow as death approaches. Hands and feet may feel especially cold to the touch. Upper parts of the body may sweat as circulation to the peripheral parts fail. Skin care, bathing, frequent position changes, and fresh garments and linens help keep the clients comfortable. Measures must be taken to prevent pressure ulcers. Elimination. The client may have urinary or fecal incontinence. Follow the care plan and keep the client clean and dry. Give perineal care as needed, and constipation and urinary retention are common. Nutrition. Needs decrease as the body can no longer deal with digesting food, so amounts of food should be reduced. Easily digestible food should be offered often. So now let's review the Code of Ethics. FirstLight Home Care Code of Ethics is adopted from the Ontario Personal Support Worker Association. These principles provide guidance to the personal support workers and designated acceptable and professional conduct. Working with skill and competence. Provide high-quality services to the individuals under their care. Employ appropriate health and safety measures in the work environment in which they are practicing. Ensure that their work activities are within the limits of their knowledge, experience, and skill, and aligned with the defined professional responsibilities of support workers. And strive to balance the need of individuals under the care and the interest of the individual's families, guardians, and/or FirstLight Home Care, acting in good faith towards all parties at all times. Working with integrity and respect for the law. In a manner that supports and advances the PSW profession or the support worker profession, work with integrity. Provide services in an honest and diligent manner. And you must not knowingly assist in or encourage dishonesty or illegal conduct. Any support worker who discovers that dishonesty or illegal conduct has been occurring in an organization or workplace should take every appropriate reasonable step to stop the activity. Support workers must not allow personal interests to cloud their judgment or to cause them to act in an unprofessional manner, and support workers must hold in strict confidence all confidential information acquired. Refrain from using such information with a view to obtaining a direct or indirect benefit for him, herself, or for another person. A commitment to respect and dignity. Respect the rights and dignity of all individuals for whom they provide care and support, and protect the physical and mental health of all individuals for whom they provide care and support. Do not condone any of the following acts directed against the individuals for whom they provide care and support, which is any acts of physical or psychological violence, and any acts of harassment or intimidation, any acts of discrimination on the grounds of race, ancestry, place of origin, color, ethnic origin, citizenship, creed, gender, sexual orientation, age, record of offenses, marital status, family status, or disability, and any sexual impropriety. And lastly, do not engage in or condone any of those same acts directed against their fellow personal support workers or other support workers. Commitment to professional growth and the support of others, PSWs or any support workers. All support workers must make every effort to keep their knowledge and skills up to date, and must take part in activities and professional development sessions, and contribute to the development of support workers. Now let's go over the Code of Conduct. Support workers respect the dignity of clients and treat them as individuals. You are to treat your clients with care and compassion. Show respect to your client's culture, identity, beliefs, and values and goals. Take steps to maintain your client's privacy and dignity in the physical space where they are receiving their care. Personal care is non-judgmental and is free of discrimination. Support workers should reflect on and address your own practice and values that may affect your personal care, and do not impose your personal beliefs and biases on clients. These include political, religious, and cultural beliefs, and if you see other healthcare team members doing this, please make sure you report. Support workers work together to promote client well-being. Support workers provide clear and timely information to clients. You are to talk to your clients in ways they understand, inviting their feedback and relaying to your nursing supervisor. Support workers strive to meet clients' language and communication needs and ask for a consistent form of appropriate decision makers when clients are not able to do so. Support workers acknowledge clients' rights to express concerns and also to respond by working with clients to resolve their concerns. Make sure you are advocating for your client and making sure that care is timely. And when this is not possible, you are to explain the reason for the delay to the clients. Support workers maintain the client's trust by providing safe and competent care. Support workers identify themselves with their first name, last name, title, and their role to the client, as well as identifying FirstLight Home Care as their employer. Use appropriate knowledge, skill, and judgment when assessing the health needs of your client, and recognize the work within the limits of your knowledge, skill, judgment, and your legal scope of practice. Seek advice and collaborate with the healthcare team to uphold safe client care and maintain and continually improve your competence. You should reflect on your practice and set learning goals annually with FirstLight Home Care educational development. Maintain complete, accurate, and timely documentation in your workplaces, and be accountable to and provide care under relevant laws and standards of practice. Support workers work with colleagues to best meet clients' needs. Okay, you are professional with colleagues, so treat them with respect, including on social media. Collaborate and communicate with your colleagues in a clear, effective, and professional and timely way. And work together with other healthcare experts to improve the client's care. Support, mentor, and teach members of the healthcare team, including the students. And make sure to take action to stop unsafe, incompetent, and unethical or unlawful practice, including any type of abuse. Support workers act with integrity to maintain the client's trust. Right, so you are to protect the privacy and confidentiality of the client's personal health information. You are not to share their information on social media, and take prompt action to protect clients from harm. And make sure you're not accepting gifts from clients unless it harms the professional relationship with the clients, of course. But please make sure to report this to your care coordinator, and this will be decided with the family as well. Support workers are not to act as powers of attorney or substitute decision makers for clients, and make sure that you declare any conflict of interest that could affect your judgment, and this includes support workers' personal, financial, or commercial interests. You are to maintain integrity and do not use your position to promote or sell products for personal gain. And do not engage in any sexual relationships with clients while caring for them. And this rule stays in effect for 2 years after the end of the support worker-client relationship. So make sure you are setting boundaries. Support workers maintain public confidence in the support worker profession. Support workers are accountable for their own actions and decisions. You are to respect the property of your clients and employers. Clearly communicate to clients the details of your care or service that you intend to provide, and advocate for improving the quality of your work setting to support safe client care. have the duty to report any error, behavior, conduct, or system issues that affects client safety, and do not practice when impaired by any substance. You are also responsible for maintaining your health and seek help if the health affects your ability to practice safely. Now let's go over infection prevention and control. FirstLight Home Care has developed and implemented infection control practices that conform to provincial occupational health and safety regulations, Public Health Canada guidelines, provincial regulations, regional regulations, and currently accepted standards of practice. The PPE for direct care of patients with suspected or confirmed COVID-19 includes a fit, tested, seal-checked N95 respirator or equivalent or greater protection, eye protection, gown, and gloves. Hand washing. The first step is to wet your hands with clean running water, warm or cold. Turn off the tap and apply soap. Lather your hands by rubbing them together with the soap, and lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds, and if you need a timer, hum the happy birthday song from beginning to end twice. Rinse your hands well under clean running water, and dry your hands using a clean towel or air dryer. And this is just a visual on how to do that. Now let's go over some PPE guidelines. This guideline is intended to inform recommended and other appropriate PPE for the care of patients with suspected or confirmed COVID-19. So let's go over how to put on personal protective equipment. The first thing you need to do is perform hand hygiene, then put on your gown, then put on your mask or N95 respirator, and then put on your eye protection, and then put gloves. To remove soiled personal protective equipment, you are to remove your gloves first, remove your gown, then perform hand hygiene, and then remove your eye protection, then remove your mask or N95 respirator, and finally perform hand hygiene again. Let's go over behavioral management. FirstLight Home Care staff are committed to meeting the needs of patients with behaviors that present a risk and protecting the safety of all patients, staff, volunteers, and visitors. This will be achieved by developing strategies and techniques to recognize and manage the behaviors that place the clients at risk. Techniques for preventing and de-escalating. So make sure you know the person with the dementia and understand the world from their perspective, and use what you know to personalize your approach. Make sure you know the client's likes and dislikes and their triggers. Consider the client's energy level before expecting participation in certain tasks, and minimize confusion or overstimulation, and ensure a calm and unhurried atmosphere. Identify and respect the client's coping strategies, and involve the client or resident as much as possible in making of any decision that concerns them. And increase social interaction. Get the person's attention, encourage eye contact, not by force, emphasizing with the feelings and behaviors of the resident, and offering reassurance to build comfort and trust. Communicate with caregivers or other team members to ensure that all staff are aware of the client's behavior. Having the staff or other members recognize the client's behavior, this might prevent and help with planning the care of this client who is exhibiting this behavior, and also use positive body language and non-threatening posture. Ensure the tone of voice is calm and positive and respectful. At FirstLight Home Care, we have zero tolerance of abuse and neglect. Staff are committed to providing the highest quality care, which encompasses the dignity, respect, and rights of client-resident, and a client-resident will be free from abuse or neglect by staff, volunteers, and peers. If a staff member or volunteer is suspected but cannot be proven, FirstLight Home Care will take proactive measures to prevent further client abuse by providing education to the employee, increasing supervisory needs within the department, and or reassigning the employee to alternate duties. If the client is alleged to have been the abuser, it is important to determine the cognitive level of the client. So assessing the needs and determining the reason triggers for the behavior, communicate interventions and ensure all staff is aware of the situation, evaluate the need for medical intervention, identify aggressive behavior and intervention on standard of practice behavior management, and identify follow-up plans with the family or power of attorney on plan of interventions. Let's go over the types of abuse. Abuse is defined as in relation to a patient, means physical, sexual, emotional, verbal, or financial abuse, as may be defined in the regulations in each case. So let's go over each one. So emotional abuse is basically any of the following. So any threat, insulting, intimidating, or humiliating gestures, actions, behavior, or remarks, including imposed social isolation, shunning, ignoring, lack of acknowledgement, or infantilization that are performed by anyone other than a client, or any threatening or intimidating gestures, actions, behaviors, or remarks by a client that causes alarm or fear to another patient, where the client performing the gestures, actions, behaviors, or remarks understand and appreciates their consequences. So these are emotional abuse. Physical abuse. This is the use of physical force by anyone other than a client that causes physical injury or pain. Administering or withholding a drug for an inappropriate purpose, or the use of physical force by a client or resident that causes physical injury to another resident. This can also apply to anyone. For the purpose of the definition of physical abuse, abuse does not include the use of force that is appropriate to the provision of care or assisting a client with activities of daily living unless the force used is excessive in the circumstances. Sexual abuse. Any consensual or non-consensual touching, behavior, or remarks of a sexual nature or sexual exploitation that is directed towards a client by a licensee or staff member, or by any non-consensual touching, behavior, or remarks of a sexual nature or sexual exploitation directed towards a client by a person other than a licensee or staff member. For the purposes of the definition of sexual abuse, abuse does not include touching, behavior, or remarks of a clinical nature that are appropriate to the provision of care or assisting a client with activities of daily living. Verbal abuse. Any form of verbal communication of a threatening or intimidating nature or any form of verbal communication of belittling or degrading nature that diminishes a client's sense of well-being, dignity, or self-worth that is made by anyone other than a client. Or any form of verbal communication of a threatening, intimidating nature made by a client that leads another client to fear for his or her safety. Financial abuse. It is any misappropriation or misuse of a resident or client's money or property. Neglect. Neglect in relation to clients or residents, the failure to provide a client with the care and assistance required for his or her health, safety, or well-being includes inaction or a pattern of inaction that jeopardizes the health or safety of one or more clients. Such behaviors or remarks include, but are not limited to, by any form of not answering the call bell or requests for assistance, intentional and repeated failure to or refusal to provide care as set out by FirstLight Home Care staff plan of care for existing condition of the client, and withholding food, medication, fluids, and health services. So, for example, neglect is also where you have fallen asleep for a client that you are overseeing overnight. So make sure you are keeping these things in mind. All right. Power imbalances is a misuse of power, which is also considered abuse. So where the staff and client relationship is of unequal power. Basically, the staff has more authority and the ability to advocate for the patient. The patient is dependent on the staff and has less ability to control situations. And there is a potential for abuse and neglect by those in a position of trust, power, and responsibility. So recognize the potential for a patient to feel intimidated within the power imbalances and how this may lead to abuse or neglect. And in order to facilitate proper use of power, the staff shall create a therapeutic and trusting relationship while maintaining boundaries. The appropriate use of power between staff and client ensures that the patient's needs are foremost and their vulnerability is protected. The role of the support worker and abuse. You should be prepared for the possibility of a client or child telling you about being abused. It's important that you know how to offer immediate help. Here are some general guidelines. Listen attentively and let your clients tell you what happened in their own words. Reassure the client that you believe what they have said and stay calm. Don't show anger or disgust. Do not ignore the problem. Assure your clients that you will do whatever you can to help and notify your supervisor at once. Follow your employer's policies, and helpful resources include the police, women's shelters, counseling services, and telephone helplines and legal clinics. But first and foremost, please make sure you are connecting with your nursing supervisor or care coordinator if you suspect any sort of abuse. And also provide emotional support no matter that they decide to do. You cannot force a client to make a certain decision. Those who can make their decisions have the right to, and those who cannot must get the help of a professional. So, legal responsibility. Every Canadian province and territory has legislation that imposes a duty to report if a child, a person with physical or mental challenges, or an adult is being abused by a parent, adult, child, caregiver, or guardian, and support workers have this duty as well. So it is your responsibility to report your concerns to the Child Welfare Agency or the Provincial Territorial Social Services Department or the police. Reporting is not time-consuming and can be done anonymously. There are laws to protect against legal action providing the reports are not falsely made and motivated by malice. Let's go over positive communication techniques. Active listening. Paying close attention to a client's verbal and non-verbal communication, listening to the content, the intent and feelings behind the words, and so follow guidelines for active listening. Face the client, where the client will often need to see your facial expressions and body language to be assured you are listening. Make eye contact. However, consider cultural preferences in regards to the eye contact. Lead toward the client. Do not sit back with your arms crossed, as this can be interpreted as an indication that you are not open and receptive to what the client is telling you. Respond to your client. Note, however, that sometimes your client may just need to vent. Avoid communication barriers, such as interrupting, answering your own questions, giving advice, minimizing problems, and using patronizing language, or failing to listen. Paraphrasing. Restating another person's message is one's own word. It is usually fewer words than the original message, and it serves three purposes. It shows that you are listening. It lets both you and the sender know that you understood the message. It promotes further communication. So people usually respond well to paraphrasing, and it's important not to interpret the client's words. Empathetic listening. This technique requires being attentive to the speaker's feelings. Empathy means being open to and trying to understand the experiences and feelings of others. It involves acknowledging the other person's point of view without judging. And empathy can reduce feelings of loneliness and sadness and create trust between the support worker and clients they support. Avoid quick, thoughtless responses like, "I know how you feel. I feel sorry for you. I wouldn't want to be in your shoes." Close-ended questions. These focuses on specific information, so you use them when you need to learn something precise. Some closed responses require a yes or no answer, and others require a brief response. Open-ended questions. These types of questions invite a person to share thoughts, feelings, or ideas. Answers must be more than a yes or a no, and the person being questioned chooses and controls what is talked about and the information given. It shows that you are interested in hearing about their life. Use both open and closed-ended questions to help find out about a client's needs, preferences, and to find out if a client is satisfied with your care. Clarifying ensures that you understand a person's message. You can ask the client to repeat the message, say you don't understand, or restate the message as a question. Could you say that again? I'm sorry, Mr. Smith, I don't understand what you mean. Are you saying that you want to go home? So those are examples of clarifying. And lastly, focusing. Limits the conversation to a certain topic. It's useful when a client rambles or wanders in thought. Give the client two choices. Let's talk about so-and-so. So this is a time to ask questions. If you have any questions, please feel free to contact me. Otherwise, congratulations, you have completed the training. Contact information for you to have. If you need this, you can either screenshot this or you can request to have the contact information from your care coordinator or the office administrators that has sent you the onboarding email. Please take this time to take all the notes that you need to with regards to contacts.